Hi, I'm Dr. Binu, consultant obstetrician and laparoscopic gynecologist from Unittas Multispeciality Hospital. So today I would like to talk few points on VBAC, that is vaginal birth after cesarean section. So I get a lot of patients who come to me and ask, Doctor, is it possible to have a normal delivery after a cesarean section? Yes, it is definitely possible to have a normal delivery after having a previous cesarean section. Though there are few important points to note. Especially there should be only one prior cesarean section. Second thing is why the cesarean was done, especially if it is a non-recurrent indication like the baby was in breech or abnormal position or the heartbeat of the baby was less or water level was less. If the cesarean is done for these indications, then we can try for a normal delivery this pregnancy. Also, it's better to have a 2 years gap during the interval, that is the previous section and the current pregnancy, though this is not an absolute criteria to try for VBAC. If it's a cesarean is done for recurrent indication like if the space in the pelvis was very less, that is CPD, or if the cesarean was done, the classical cesarean, or the extension of the scar was there, complicated cesarean, and if you have had a fibroid removal surgery, then you should never try for a VBAC. Also, if you are trying for a VBAC, then your doctor is going to take a consent form which will state that while doing a VBAC, anytime the scar can give way and the baby's heartbeat, if it reduces, an emergency cesarean may be needed. For that, the hospital should have a backup of doing a cesarean section 24 into 7. That is the NS, that is OT staff, and the gynecologist should be present throughout. So, the last thing is if you're trying for a VBAC, make sure you don't gain too much of weight during pregnancy. Keep doing the antenatal exercises. And if you get into a natural labor during the pregnancy end, that will give good result during VBAC rather than inducing the labor. That is, the spontaneous labor pains will land up in natural delivery rather than the induced labor. And doctor may do a scan to check for the scar thickness. If it is more than 2.5 mm, the scar thickness is adequate and you can have a VBAC. Though the ultrasound finding of scar thickness is again not a very reliable criteria. So make sure you just follow all these and you can definitely have a VBAC if you really follow these guidelines. Thank you.